India is finally writing the rule book on fat. For the first time ever, the country is drafting national guidelines to screen, to prevent, and to treat obesity. Obesity, which is, as we know, a silent epidemic that's now overtaken both our cities and our villages, both adults and children. From redefining how we diagnose obesity to setting strict boundaries on weight loss drugs like GLP-1, this playbook could reshape everything from school nutrition policies to who qualifies for bariatric surgery. Here's what's coming and why it matters.
Obesity is no longer a silent issue in India. It is now a full-blown public health emergency. More than 1 in 4 Indian adults is classified as overweight or obese. That number has tripled in just over a decade, cutting across age groups, income levels, and geographies. Even among children, the trend is rising at an alarming pace. But these statistics we already know. Question is, what are we doing about it? Now, for the first time, India is preparing National Obesity Guidelines, a long overdue roadmap for screening, prevention and treatment. Experts from the Indian Council of Medical Research, the Health Ministry and specialists in endocrinology and bariatric surgery, nutrition and public health have started work on what could be a turning point in how India addresses its weight crisis. Obesity in India has become both common and deeply misunderstood. According to recent data, 24% women are overweight or obese, 23% men are overweight or obese. Children under 5, obesity rose from 2.1% to 3.4%. And it's not just about weight on a scale. You would know that by now if you have been watching this space. Many Indians with a normal BMI still carry excess abdominal fat, which is a strong predictor of diabetes, hypertension, cardiovascular disease, and even some cancers. To understand this better, let's look at the obesity map of India. Some states are seeing particularly high prevalence. Kerala 65.4%, Punjab 62.5%, Delhi 59%, Tamil Nadu 57.9%, states like Jharkhand 23.9% and Madhya Pradesh 24.9% report lower obesity levels. Risk factors include age, urban lifestyle, higher income, and dietary habits. Obesity rates are also notably higher among certain communities, including Sikhs, perhaps due to eating habits. Interestingly, the World Health Organization recommends population-level interventions such as sugar taxes, front-of-pack food labeling, and restrictions on junk food marketing, especially to children. India's upcoming guidelines will likely draw on these global frameworks while adapting them to local healthcare and cultural contexts. So what will India's new guideline cover? We are learning they are expected to include early detection tools beyond BMI, including waist circumference and metabolic risk markers, population-level prevention strategies in school, workplaces and urban spaces, lifestyle modification protocols focused on diet, physical activity, sleep and stress, medical therapies, and this is critical, including modern drugs like GLP-1 and GIP receptor agonists that mimic gut hormones to reduce hunger and slow digestion. Updated bariatric surgery criteria for individuals with morbid obesity. Yes, GLP-1 drugs are likely to find mention in the obesity guidelines. The new guidelines are expected to include strict protocols to regulate misuse, when, how, and under whose supervision these drugs can be used.
Obesity, remember, is now one of the strongest drivers of non-communicable diseases in India, including diabetes, hypertension, fatty liver, and cardiovascular disease. Some cancers have also been linked to excess body fat, especially in the abdominal area. India, however, remember, is facing a dual burden: widespread undernutrition in subsections of the society and increasing overnutrition and obesity in the others. For years, there have been no unified national approach to deal with the latter. This new guideline could change that. Of course, the key is going to be in adoption and its implementation across the country. Sonal Mehrotra Kapoor for India Today. So it's a good guideline, much needed guideline that is now underway. We still don't know the date at which it will come out and what exactly it will have. These were some of the things that our reporter Milan actually picked up with her sources as well. But you know, when it comes to obesity in India, it's been a day of contrasts. Why? Because on one hand, we are setting to release the first ever National Obesity Guideline, a much needed framework, like I said, that could, by the way, include the use of GLP-1 drugs to treat obesity. That will be the first of its kind. But on the other hand, the Indian Medical Association has sounded alarm over their rampant misuse, warning that any doctor, including a dermat, a physio, even Ayurveda practitioners, are now prescribing GLP-1 drugs. And this will lead to massive misuse, and without any proper supervision or expertise, this could be very, very dangerous. GLP-1 is now, as we know, or perhaps has been the experience even in the West, is turning out to be a double-edged sword. Huge medical promise on one side, serious consequences if misused on the other. Milan now joins us more on this story as well. Milan, like I said, it's a day of contrast. On one hand, government is recognizing GLP-1 drug, all discussing whether or not it should be included into the guideline. On the other, doctors are saying, hold on, let's limit the use first. Let's figure out what is the best way to roll out GLP-1 drugs.
Absolutely, Sonal, because GLP-1 drugs essentially were earlier part of the type 2 diabetes and type 1 diabetes guidelines that had been issued by the ICMR. Now, the National Obesity Guidelines, need of the hour, of course, are now being worked on by the Indian government. And certainly this is after Prime Minister Narendra Modi has also mentioned that obesity is becoming a silent killer and silent crisis in the country. And when you talk about misuse, of course, the IMA doctors, they're suggesting that the Ayurveda practitioners, etc., are prescribing it. It should not be prescribed by anyone other than an expert endocrinologist. And on the other hand, when you talk about the contrast, of course, the bariatric section of doctors who reduce weight, with surgeries are all obviously going to be against the rampant misuse of these drugs, because once the generics enter the market, and we are soon perhaps going to see that happening once the patent for semaglutide expires, in some countries at least, what's going to be the impact on India is also a larger question, because right now GLP drugs are not in the reach affordability level of everyone, but that's going to happen pretty soon. And then of course it should not be available over the counter and should be prescribed, but we're also looking at side effects and people have to be educated on that. So therefore the National Obesity Guidelines will pave the way for that. But this was just the first meeting, and of course my source tells me there's going to be more discussion on the weight loss drugs as well. Sonal?
All right, so we are waiting for that, all eyes on that as well, as we wait to see what is the formal guideline that the country will actually come out with.